Today we are going to be talking about treating the skin laxity and wrinkles with the Cyton Jewel platform. And when we talk about skin laxity, I think it's a problem we are facing every day in our practice. We have different areas of the body which are affected with the skin laxity, and it is considered one of the challenges we have in our practice. But when we talk about the skin laxity, it's very important to pay attention to the other layers of the skin, because if we treat skin laxity only without paying attention to the other layers of the skin, then the outcome is not going to be as satisfactory as we deal with the patient as an whole, and we pay attention to the other layers of the skin. So it's very important to see for any patients who are coming for improving the skin laxity, is there anything affecting the epidermis or the dermis besides doing a procedure in order to improve the tightness or the laxity of the skin. So when we have someone coming to complain of laxity, mainly the objective is to have healthy skin. And how can we have healthy skin? By having smooth skin, which is happening due to normal keratinization. The healthy skin is firm, and this is going to be attained by having abundant normal functioning collagen and elastin, which we start to lose after the age of 20, as we are going to see later. The normal or healthy skin is evenly colored, and this is coming from properly functioning melanocytes. If we have problems with the pigments of the skin, it doesn't look healthy, and we need to pay attention to that. And then the healthy skin should be properly hydrated, and this requires intact barrier function. So this will take us to this slide, which is the composition of the epidermis, whereas the normal healthy epidermis is supposed to be composed of 65% living cells and 35% corneocytes. With aging, we'll have reversal of this ratio, so instead of 35% corneocytes, it's going to increase to 60%, which we call hyperkeratosis, and the living cells, instead of being 65%, it goes down to 40%. What is the impact of that? Actually, there are threefold impact of that. When the living cells are less in the skin looks dull. It doesn't look fresh and viable. So this is a problem which we are facing sometimes, where patients are coming for rejuvenation. They are not happy with how the skin is looking. When we examine them, there is no pigmentation or wrinkles or pore size, but the skin looks dull. Why? Because with less number of living cells, the nutrition is impaired, the metabolism is impaired. This is the first impact. The second impact is that when we have hyperkeratosis, whatever active agents we apply on the skin is going to be lost. It's going to be absorbed by the corneocytes, which is not going to be affected because it's dead keratinous cells. And whatever penetrates deeper to the underlayer of living cells will find less number of living cells to work on. So the active skincare products, which everyone uses, is going to be almost useless. The third thing, which is the most critical, when we have accumulation of corneocytes over the surface of the skin, they are not going to be overlapping well. They are not going to do proper barrier function of the skin, which will increase the predisposition of irritations, allergic reactions, infections. But in addition to that, it's going to lead to transepidermal water loss, and the patients will complain of skin dryness. What's the impact of the dryness of the skin? It loses the elasticity. So dry skin is losing elasticity, and this is going to be reflected on pore size, on fine lines, and on bad texture of the skin. So just by paying attention to improving the composition of the epidermis by doing a keratolytic procedure, which in Cyton case can be done with a procedure called microlaser peel, which is just ablation of superficial layers of the skin with microns, number of microns we determine, then we can stimulate the living cell layer proliferation, so we can return the composition of the epidermis to the normal. This is going to be reflected on how the skin is viable. It is going to be reflected on much better absorption of the topical agents, and also it's going to be reflected on the hydration of the skin, because the skin will have an intact barrier function, and this is going to be associated with improvement of texture, large pores, and also fine lines, simply by doing that procedure. So this is an example of a patient who was treated with the microlaser peel. 40 microns of the skin were ablated, and you can see how the skin is looking much better. It's not only the superficial layers of the skin, but also because of the improvement of hydration, we can see that the texture of the skin has improved significantly. So this is the uppermost layer of the skin, and we have to pay attention for any single patient who is coming, even if he's coming for skin laxity, because only then we are going to be able to deal with the epidermis, which is a crucial step in dealing with the skin laxity. This is another patient who is having a lot of freckles, and we can see that it's not only the freckles which has been treated very significantly, but also the texture of the skin has improved because we were able to restore the barrier function of the skin. So this is a step which we need to pay attention for. Then the second layer of the skin is the dermis, and we know that it is composed of water. 75% is water, and 20% is proteins, collagen, and elastin. And it's important to remember that in chronoaging, after the age of 20, we start to lose 1 to 2% of the collagen, of body collagen per year. And this is going to be doubled with the photoaging. So this means that starting from the age of 20, we need to keep in mind that we are losing collagen, and we need, within the process of rejuvenation, to do something in order to stimulate the collagen. And one of the very good solutions of Cyton is a laser called Halo. And this is a hybrid fractional laser, which is composed of two wavelengths, the 1470 wavelength, which is a non-ablative fractional laser. We can tune it from 200 to 700 microns, and this is going to optimally target epidermal and dermal photo damage and chronoaging. And also the other wavelengths is the 2940, which is the well-known erbium, which is going to lead to up to 100 microns of ablation to target intraepidermal tissue. So we know that the non-ablative fractional laser is easy to do the treatment, no bleeding, the downtime is very short, and the results are a little bit less than the ablative lasers, which are having better results and outcome, but the downtime is more. So when we are combining both of them together, then we are getting best of both systems with low morbidity, fast healing rates, fewer complications, and better outcome. Why the 1470 was selected by Cyton? Because it has very optimum absorption by water. So in this case, we are going to be able to have much better absorption than the very high ablative lasers, and with higher absorption of water, we are going to have limited depth of penetration. And as a matter of fact, when we look at the photo damage, we'll see that the elastosis, the loss of collagen, is confined to the upper dermis. So this is what we need to target. If we go deeper with a wavelength which is having less absorption by water, then this is going to have higher incidence of post-inflammatory hyperpigmentation. But when we target the right zone of the skin, then we are getting the effectiveness we need, and at the same time with much better safety. So this is the area we need to target, which is the upper dermis, and this is what we can achieve with this wavelength. So using this wavelength, we can treat pigments in the skin, wrinkles, sun damage, acne scars, and dermal elastosis. A very wide variety of conditions which might be seen in a patient who's coming for skin laxity. And those are examples of patients treated with this halo laser, and we can see how much the skin texture has improved with very minimal downtime. General texture improvement, pigmentation, wrinkles, and we can see the improvement in the skin. So if this patient is coming for skin laxity, is it enough to use a tightening device, or we need to pay attention to the other layers of the skin in order to get the optimum outcome? This is how I would approach a patient who's coming for skin tightening. If we focus on the complaint of the patient, we'll never get satisfaction. And I think this is one of the reasons why many procedures which are targeting skin tightening is not satisfactory, because we focus only on skin tightening, whereas the skin is composed of other layers which need some more attention. So this is the advantage of having this ablative fractional results with non-ablative downtime, achieve results in fewer treatments, and very comfortable treatment with little to no downtime. Now we go to the third layer, which is the subcutaneous fat. And we know that with the skin laxity, you get looseness, flaccidity, and hyperextensibility of the skin. And this starts to appear at the third decade of life. And we can see the difference between the young skin, where we have the rated ridges, the collagen is very well organized, But with aging, we start to have reduced vascular tissue, disorganization and loss of collagen fibers, and smoothing of the rete regis or the dermoepidermal junction. Again, it shows the same disorganization of the collagen, and we start to lose the collagen, especially in the upper derms. So with aging, we know that we lose the subcutaneous fat, so the skin becomes lax. Now, if we have good collagen in the skin, this is going to compensate the laxity. If we don't have good collagen in the skin, then we'll have lax skin and wrinkles. So we need to do something in order to tighten the skin and stimulate the collagen. This is the objective of the treatment of any procedure with the objective of skin tightening. So the rationale of the skin laxity is that the skin will contract by applying heat slowly, progressively, and sustainably. And this is very crucial and very important. All the other trials before was using the pulsed Nd:YAG laser didn't work. Why? Because even if you use 50 milliseconds, it is pulsed laser, so it's not going to lead to sustained heating of the skin. This is what we need in order to achieve good effect in treating skin laxity. Clinical relevant changes occur when dermal temperature elevated to 45 degrees for several seconds. So it's very important to sustain the temperature at this level for some minutes even. So this is the collagen, and then we do the heating for some time, for 2 or 3 minutes, and this is going to lead to denatured collagen. So what we are going to get is immediate thermally mediated enlargement of diameter and shortening of the length of collagen fibers, but also we are going to have medium long term, which is the inflammatory response we are creating, and this is going to invite fibroblast, and fibroblast will synthesize new collagen. So we are depositing new collagen in the skin. A very important thing here to be mentioned is that we are going to have new collagen deposit in the skin within 3 weeks, but this is immature collagen. It's not going to be with the full efficacy or strength. And we have to let the patient know that the improvement is going to happen and continue for 6 to 8 months after the procedure, so that they know what to expect. What we need in the energy source we are using, we need to create controlled thermal effect, contain heat to a specific clinical area, and minimize the damage to the surrounding tissue. And for that, when we have the normal temperature gradient between the surface of the skin and the deeper layers of the skin and the body, which is 37, we need to apply a device, and in this case it's the Skin Tide 2, where we have a cooling sapphire and then the light source and filter. So, and this is the patient's skin. So we apply the cooling, which is going to decrease the temperature to 12 degrees centigrade, and then we apply the light, which is infrared light, and this will increase the temperature to 42 degrees, and this is going to be sustained for about 2 or 3 minutes during the treatment process. And this is going to denature the collagen, causing immediate contraction, and also will generate the fibroblast, which will lead to the long-term remodeling. Where are the treatment areas? Actually, any place in the body can be treated, whether it's in the face or the nasolabial folds, the upper face, abdomen, arms, thighs, or hands. So any area in the body can be treated with this technology. And we can see very nice results as long as we are doing the proper patient selection, limit the expectations, and do the combination treatment as mentioned before, then we can get very satisfactory outcome in almost every single patient we treat. And this is one of the unique things about this technology. The results are very reproducible. So it's not like some other technologies which we used, where there are 30% of the patients who are going to get no results. As long as you are doing the appropriate patient selection and technique and combination, you are going to get results in every single patient. We can use it for hand rejuvenation, abdomen. It's one of the very nice areas, and the reason of that is that it is really very nice to treat. We have variable spots, so we can treat different, even small areas. Usually the abdomen will take 15 to 20 minutes, and the reason of that is that the spot size of the Skin Tide 2 is really one of the largest in the industry, and because of that we can treat an area of 400 centimeters square in almost half an hour, which is if we compare it to any other technology, it's really very quick, and this is a major advantage. So we can have the choice of having a platform which is having the erbium YAG, the micro laser peel for the epidermis, the halo laser for the dermis to stimulate the collagen, and also the BBL with the skin tight in order to deal with the skin laxity. Or we can have a smaller platform which is having the BBL with the skin tight, which is having the skin tightening device, but also an IPL for the other epidermal and superficial problems. So with this platform, really you can do whatever you need for any skin type and any skin condition. And thank you for your attention.